Can you have sex after a hysterectomy? This question keeps so many women awake at night, worried that their intimate life is over. Today, I'm going to give you an honest, complete answer you deserve. I'm a pelvic health advocate, and I've supported thousands of women through this exact journey. We're going to cover the medical timeline, what actually changes in your body, the changes you might face, and most importantly, the practical solutions that really work. By the end of this video, you'll have a clear roadmap for reclaiming your intimate life. Let's start with the big question. Yes, you can absolutely have fulfilling sex life after a hysterectomy, but like any major surgery, your body needs time and the right support for healing. The healing timeline, your doctor will tell you to wait 6 to 8 weeks before any penetrative activity. This isn't arbitrary, it's based on how your body heals internally. When your cervix is removed, surgeons create what is called a vaginal cuff. Think of it like a carefully sealed envelope that needs to become strong and flexible again. Week by week, here's what's happening. In the first 2 weeks, you're focused on basic recovery. By weeks 3 and 4, your energy starts returning. Weeks 5 and 6 bring your follow-up appointments and discussions about resuming activity. And at 6 to 8 weeks, you typically get medical clearance. But here's what medical timelines don't tell you. Getting clearance doesn't automatically mean that you're ready emotionally or physically. Some women feel comfortable at 6 weeks and others need 6 months. Both are completely normal. What actually changes, let's be honest about what might feel different. If your ovaries are removed, you might experience instant surgical menopause. This can significantly cause vaginal dryness because estrogen maintains tissue thickness and natural lubrication. The vaginal cuff creates a scar at the top of your vaginal canal. Sometimes the scar heals tightly, which can cause some pulling sensations during penetration. Your pelvic floor muscles might also develop a guarding response. They tense up to protect you from potential discomfort. But here's the good news. Your clitoris, with all of its nerve endings, remains completely untouched. Your ability to experience clitoral pleasure is actually the same as before surgery. Common challenges and solutions. Vaginal dryness is the most common issue. Without adequate lubrication, penetration can feel uncomfortable and even painful. The solution, high-quality lubricants become non-negotiable. I recommend non-silicone-based formulas for their longer-lasting properties, especially for sensitive tissues. Water-based lubricants are the best, and they're different from other lubricants. Their moisturizers are different than other regular lubricants. You can use them 2 to 3 times weekly, not just during intimacy. They help restore tissue health over time and maintain proper pH balance. For women dealing with scar tissue, tightness, or muscle guarding, vaginal dilators can be incredibly helpful. These medical-grade tools come in graduated sizes and help gently stretch tissues while training your muscles to relax. Many healthcare providers, including our team at Vuvatech, have seen how these tools can transform a woman's recovery journey. Hormone replacement therapy is another option worth discussing with your doctor. Local vaginal estrogen in particular can help restore tissue thickness and improve comfort for many women. The emotional side, physical healing, is only a part of the story. Many women struggle with feeling different or incomplete after a hysterectomy. These feelings are valid and common. Your worth and capacity for pleasure were never contained in any single organ. Communication with your partner becomes more important than ever. They might be worried about hurting you. You might be afraid of pain or disappointment. Open, honest conversations about fears, expectations, and the need for patience can actually strengthen your relationship. What often improves. Here's something encouraging. Many women report that their sex lives ultimately improve after a hysterectomy. Why? Because the underlying pain conditions are finally resolved. They can relax and enjoy intimacy without the fear of symptoms. They're forced to communicate more openly, which often leads to better connection overall. Professional support. Don't hesitate to seek help when you need it. Pelvic floor physical therapists specialize in exactly these issues. They can help with scar tissue management, muscle relaxation, and developing comfort with penetration. If you're experiencing persistent pain, significant anxiety, or relationship strains, specialists in sexual medicine, hormone therapy, and counseling can provide targeted support. Most women see significant improvement within 3 to 6 months. Some feel comfortable sooner, others need more time. The key is being patient with yourself and focusing on gradual progress rather than rushing toward some arbitrary timeline. Remember, this isn't about getting back to exactly how things were. It's about discovering what your new normal can be. With the right information, tools, and support, the new normal can be every bit as fulfilling as before. Your hysterectomy marked the end of a chapter, but it's definitely not the end of your story. Start by having an honest conversation with your healthcare provider about your concerns and options. Consider connecting with a pelvic floor physical therapist, and remember that tools like vaginal dilators can be a game changer in your recovery. Most important, be patient and compassionate with yourself. Healing takes time, but pleasure and intimacy are absolutely within your reach. You got this.